We can hear.
Morning.
Good morning.
Good morning, everyone. Greeting in New Year. I hope this year was started successful for everyone, and you have a big hope for how this year will continue. Hello, Maria.
Good morning, everyone. Do you hear me? Yes?
Yes.
Okay.
So, friends, thank you. You receive our invitation for this event. Thermal Tourism Business Summit. This is the first edition, and it is online because it is allowed us to join people from over the globe. I understand everyone tried from online. A lot of people told me about oh, we will not attend because it is online. We wish to attend offline. So, but any case, yeah, our event was joined people from Arabic countries, from USA countries, from European CIS countries. So actually online, it is a very good possibilities to do it. And why we organize this event? What is the main reason of this? Now everyone feel it, everyone see it. Tourism was changed. And a lot of touristic agencies started to learn more about health approach, about wellness, about spa tourism. And a lot of countries can receive people if they going to some resort treatment, but not for tourism reason. So that is why a lot of people need this like knowledges, and a lot of hotels and resorts need this new people, new faces, new agencies to get to know them. So that is why we organize this event. And Maria, please tell a few words, because you are main organizer, so, organizer of the event. This is platform Booking.net. This platform allow hotels and the companies to provide food packages with treatment. It is very easy to work for agencies. Please, Maria.
Yes, later on we will also see a presentation of Booking.net and how it works. Welcome everyone. Yes, as Natalia said, we are handling this event online because it is not possible to do it live. We will do the live event on June as every year, and it will be this year also in Abano Terme, like the last and the past 3 years. So we are inviting you all to join us in Abano Terme for meeting personally. We are hosting and inviting more than 100 buyers together with 20 health insurances from medical tourism field also. And what to say, Natalia is much better than me to moderate events online. So I wish to thank you to attending, and hope you enjoy this meeting. Thank you, Natalia.
Thank you, Maria. Thank you. So our conference will around 2 hours, and after that we will continue our business part with B2B meetings. So now I don't see our speaker, but we have a record of Chila Mezoshi, Secretary General, European Association (SPA). She will speak post-COVID treatment on health resorts, approach and experience of several countries. Very interesting presentation. So, Chila Mezoshi, Secretary General, Association European (SPA). Welcome to the Thermal Tourism Business Summit.
Thank you very much for the invitation, and I guess a lot of friends and colleagues are with us, and I'm happy to be with you and to share information on the Thermal Tourism Business Summit about our association work and about a lot of new content from our members. First of all, just a short introduction. Maybe most of you know or heard about European spas. We represent 20 European countries. They have natural remedies with evidence-based medical studies. And we promote more than 25 years the use of natural remedies. And this is based on thermal water, healthy climate, mud, and of course, many other healing resources of the nature. I would like to express a very special greetings from our president, Mr. Thierry Dubois. And as you see, medical competence is a very important issue in our association. Our president is also president of the French Spa Association, Medical Spa Association. He is president of a medical research organization in France. And he's the chairman of Sajon Spa Group, which is the oldest spa resort in Europe related to mental health, which becomes also more and more important, especially if we talk about the new issues post-corona or long COVID treatments. For all of us who works in a spa business, these keywords, well-being, life balance, healthy lifestyle, prevention, is the money making, and how we want to show our advantage related to the spa business. We can provide much more, even if we put the natural remedies in focus. So as you see, we have, beside the thermal water and mineral water, which is the main natural resources, natural CO2 gases, mud, healing air, negative ions in the air, physiotherapy, hydrotherapy, medical massage. So it's a complex service, as you know or you practice already. And our visitors, they respect and they know, and that's why they are repeated visitors, why we have medical competencies. But definitely, if we talk about overseas markets, our visitors, they look for the clean air, for the very special nature, for blue sky, and of course tradition. And as you know, 12 of the spa cities in Europe became World Heritage last year. So we can say that this is a European World Heritage. Spa cities, urban planning, and the medical competencies that we use in our spa resorts. And as you see, some of the countries, member states of the European Spa Association, like Slovenia, Hungary, Slovakia, the Czech Republic, % of the whole turnover in tourism by these had tourism related to medical spas. That's why they are very specialized tour operators with whom we work together. And just give you an overview of the last years, I would say the last 2 years, not only economic results, but also how we have to change the medical programs, how we have to update our services. And most of you have more or less, but we can say in an average, we have loss of turnover by 30–40%, or at least by the arrivals. It's related to lockdown or to get more complicated to cross the borders. And some of our colleagues, they made a quite big research, as you see, with 50,000 participants. And they measured the health condition and the life condition of the patient, where they had to postpone the spa treatments because of the lockdown, or they were not able to visit any spa resort because of other reasons. And it's very significant. The symptoms what they had, it was before going every year once or twice to a spa resort, pains, let's say, measured by almost 30%, became, after 1-2 years not visiting the spas or the medical spa resorts, became 63%. It's a really huge difference. And then if you see also how the quality of life was changing, they give very detailed information, and we were very shocked about the results. Also the drug consumption, or how many times they were visited doctors when they could go to the spa and they were feeling quite okay, and they had no big health issue problems. The visits of the doctors was 8.3%, and after 2 years, it became almost 30%. And the same with the drug consumption, like visiting spas, and you have less pain, you are more mobile, you feel much better, was 6.5%. And later on, 1 or 2 years later, the drug consumption became more than 30%. And that's why our members, they had to update also the services, which means a lot of new programs for long COVID and post-COVID treatments. And we figured out that the concentration, and because it's a very personalized treatment, it was mainly for respiratory problems, for cardiovascular problems. Mental health became a big part or a main part in each programs. And if you know the risk factors, then it's obviously that obesity became one of the main focus. This program lasts from 10 days till 4-week programs. And I would say every day, every week, we learn from our members a lot of new projects. As you know, medical competencies are important for us. So we talk mostly from prevention, and our main business is to the management of chronic disease. So biology, as we call spa medicine, is also helping for the clients to have less side effect or to get faster back to the normal life. And that's why I would like to introduce you some of the programs, how we, or which kind of aspects by the patient care was very important for our doctors. As I said, respiratory, but also motoric, skeletal disorders, cardiovascular, gastroenterology, immunology, detoxification, stress control, mental health, and so all kind of areas we can combine with biology. And of course, the reduce of chronic disease was still the priority. So we can say that this unique knowledge of biology, it's a European cultural heritage. And that's what we have to use also, and to communicate it very well to make a special business and a space as a know-how for Europe. Well-being and health for body and mind, it's clear for all of us. And as you see, thalasso, nutrition, all kind of activities in the nature, and boosting immune system. This became also our new keyword, how to learn and practice the healthy lifestyle. And I want to show you some detailed programs, but I don't want to replace our specialist doctors. They work on this field. But I will give you the website where you can see all this documentation, like video, where our professors are talking about different disciplines, how they treat patients. For example, Mr. Professor Martin Gehlen as a rheumatologist in Bad Piedmont. Then we had an excellent presentation from Margret Grimsdottir from Iceland. They specialize for cardiovascular problems and chronic fatigue. And Actually, both of them are specialized for mud treatments. And here I recommend you also to see how they measure the result, the medical result of the patient, because that's what finally gives you the feedback also for your patient. Then our Vice President, Dr. Janka Zalashekova, actually Slovakia is the only country, or it was the first country in Europe to make legal changes and to have post-corona treatment as a fully paid treatment in medical obesity prevention program. Then, as I said, mental health is a very upcoming product in medical spas. So Massajon was explaining the hydrotherapy in relation to post-COVID treatment. And we had also pulmonologist, Mr. Dr. Lafi Abu Shiran from Clinic Bad Zulza. So I recommend to visit these videos if you want to go in a deeper information and to get feedback from the doctor, from the medical side. Of course, I recommend you also from the European initiatives from last year. Here we had also good example from Slovenia, from Slovakia, from Serbia, from Bulgaria. So here you can see other aspects of post-corona treatments provided by other countries. And we were one of the main players on the ITB last year, also to show the first results and the system, how in different countries is the financial support of health insurance companies. So here you will hear examples from France, then from Germany, which is located on the seaside in North Germany. So it's Thalasso and Climate Health, and also from Hungary. I have two slides here from Slovakia, because that's really the best case at the moment. And you see how many therapy they offer. I mean, how good mix you need to treat your long corona or post-corona patient. And as I said, 21 days or 3 weeks treatment is paid by the health insurance company. Another good example is some of the winner of the Innovation Award of last year. Of course, we try to concentrate to give by the innovation also to show the best cases, how our medical spa professionals provide new programs for our patient or guest. I don't want to call them patient, I prefer to say guest. So the winner of the innovative medical spa was a Georgian company with a combination of a laboratory checkups, very high-end checkups in a private hospital, and to make the personalized treatment according to the results in a climate health resort with mineral water and also thermal water in Sairme Resort in Georgia. So that was really a very impressive example. Actually, we made also a lot of PR also with the World Tourism Organization. So this became a really best case in Europe. Then innovative health spa program winner was Septopolis Medical Spa from Bulgaria, from the Rose Valley. And that's what I heard also later on from our colleagues, that was the most recognized program in Bulgaria for the post-corona treatments. And of course, we need results and research to prove the medical effect. And the category medical spa scientific research, the winner was Ensana Hotel Spa Hotel, which operates in 5 countries: Czech Republic, Hungary, Slovakia, Romania, and the United Kingdom. And this study was made with a 3-week program with 25 medical treatments made in the Czech Republic. So all this information, you find more details on our website. And of course, I'm more than happy to contact with these specialists, but these are, I would say, the best cases at the moment in Europe. For more information, I want to ask you to contact the European SPAs or to follow us on social media, or just check the website and the special links like recovery concepts or medical spa. And I recommend even the e-library, because we collect also medical researches also related to the corona disease, of course. Thank you very much, and I'm waiting for your questions.
Thank you, Cila. Thank you. Actually, amazing experience. For other countries, for example, for Greek, for Ukraine, for example, is it possible to learn this experience, to maybe to implement this experience in their country? Is it possible with the European SPAs Association?
Yeah, that's our job, networking and to support and to show the best, because in this way all other colleagues can learn and to extend the portfolio. But it's the goal for all of us to help people to stay healthy.
Yes, sure. Thank you. And I have one question. It is just your opinion. What is the future of spa tourism in 2022? Do you think this industry will become a leader among of other type of tourism, for example, cultural tourism or medical tourism? What do you think? What is your opinion?
Look, it's very easy to answer, because otherwise it would be not my passion to work for medical spas and for health tourism. And as we know, this pandemic luckily give more attention for everybody to invest in health, because it's our biggest value what we have, and we have to take care of it. And that's why I'm sure that health tourism has a much better chance if we do it well, and of course if we communicate well, and we stay also on a very serious medical base. And that should be the job from all of us, to provide serious programs. Not, of course, the difference is not to spend these rehabilitation prevention programs in a clinical atmosphere. We provide a nice nature and a completely different atmosphere and services, of course. So people can recover much faster and they feel much better in these resorts. But we have to take care also about the seriousity of our programs. And that's why I'm telling always medical competencies are our unique selling point.
Yeah, agree with you totally. Thank you so much. Thank you. You came for our event. I know you are too much busy. So wish you good luck, and I hope your experience will be useful for every country, not just Europe.
Yeah, as I said, I'm not a medical doctor. That's why I prefer, if some of your, the audience is interested in special know-how, it's better to visit these videos. Our website is very transparent, even on the YouTube channel. And by the recovery concept, you can see most of our forums and internet platform. You can learn from.
Yes. Thank you for your support.
Partners. Thank you very much, and stay healthy. That's the main address for all of us. Thank you very much. Bye-bye. So
Cila Mezoshi among the go fast. Cila, can you say to add something? Cila, can you speak now? Maybe someone have question to Cila. Okay, let's continue. So our next speaker, it is amazing person. This is a friend of mine, and I'm happy to introduce our good friend. Yes, this is Dr. DoctorGEO&SPA. Dr. Prem, I know you have to be here.
Hey,
Dr.
Natalia,
Prem?
yes. Yeah, I'm here.
You are here. Great. So the president of European Association spoke a lot about mental health, and which has become relevant during the pandemic and the virus attacks the nervous system. We know it. So you are provide consulting for spa hotels and health resorts all over the globe. And my question is, what is your impression? Is there a demand of these programs among your partners?
So first, Natalia, thank you for introducing me. And indeed, it's a great friendship. And I appreciate what you, Maria, and all the industry players are doing together. I don't know if you can see me on the screen, I guess. Yeah, anyway. So it's really good to be here, and I appreciate what you are doing together to raise awareness and create some sort of momentum in the industry. I have a presentation today, and I decided maybe, it's better for me to create a video because sometimes you have a problem with the net. So we will run that video presentation. But this is a unique topic called mindful business strategy. Now, we all do mindful practices in our daily life. We do meditation, we aware about ourselves. But in current pandemic time, when we have a huge amount of challenges, our business needs to be highly focused. We don't have a huge marketing budget. We don't have too many staff members. So we have to be very careful about what kind of strategies we are going to create. So this presentation, though the term I'm using a lot of time is medical tourism, but it's combined. Either you use it for medical tourism or wellness tourism. The presentation remains same. And I talk about why we had to be very focused. We had to have a lean practices and why we had to be mindful about our business practices. So Natalia, I suggest let's play the video presentation. And after that, I will share a few words. Is that okay?
Yeah.
Perfect.
Good day, my friends. We are going to talk about medical tourism leadership, developing mindful, sustainable, and viable business strategies. You might ask me that why do we have to talk about the mindful business strategies in medical tourism? We all know the impact of the COVID on the medical tourism industry. In fact, that is going to be my subject, that what is actually the impact of COVID on travel industry and global healthcare industry, and together what is the impact on the medical tourism industry. When I talk about the impact, you will realize that how important it is for us to start thinking about developing more mindful, more sustainable and viable business strategies, along with how we are going to integrate the wellness strategies. So today I'm going to discuss that this COVID has created a massive impact on everything. Results are unbelievable of everything that we have done in our life and business and economy. Somehow, I guess medical tourism is blessed during this COVID that the unorganic growth of medical tourism has stopped right now, and now we have much more better idea about how we can develop more sustainable, more viable, more mindful strategies in medical tourism industry. But first and foremost, let's talk about why and what kind of impact this COVID had on entire tourism industry. We all know that more than 84% travel was stopped because of the COVID. And we also know that nothing is going to be the same before 2024. Even if we don't talk about new variable, even if we talk about high vaccination and all, still the industry is going to have a little slow rate in terms of coming back. What it means to medical tourism industry? The question is that medical tourism is a combination of two things. One is people traveling from one place to another place. So obviously there is a travel involvement. And second is a healthcare demand. But let's look at how COVID has impacted healthcare. You would surprised to know during the peak time, in just 12 weeks, 28.5 million selective or you call elective surgeries were postponed during the COVID time, during the peak period, 28.5 million. There was a time where in UK, United Kingdom, patient waiting time increased from 4 million to 10 million patients. 10 million patients were waiting for the treatment. In fact, there was a time in which in France, 75% people canceled their appointment. In fact, they delayed getting the medical treatment in US and everywhere in the world. And it's just not only about medical industry, even in the wellness industry, stress and anxiety actually tripled. The number of cases reported to the psychiatrist and psychologist were 3 times more. More than 15% people use drugs and substance abuse to deal with the COVID-related stress. And in fact, the inactivity caused 9% premature death. So, in general, COVID pushed healthcare even further worse. What exactly happened? And I need to explain you that during COVID, healthcare deteriorated. It went actually down. It went worsen. Why? Because the access to healthcare was not easily available. African patients who were traveling to India or other part of the world, they could not travel. Indonesian patients are not able to travel to Malaysia for the treatment. Middle Eastern patients who were traveling to Europe or Jordan and other places, they were not able to travel. And they could not get the medical services they want because the halt of the travel. But does that mean that they got recovery? Or does that mean that they got treatment? We need to understand one thing. If someone wanted to go to honeymoon or a wellness retreat for a vacation, if he or she didn't go for that treatment, there was a loss of travel business for a week, for 10 days, for a month, and year. It was purely loss of a travel business. But in healthcare, if someone wanted a knee replacement, someone wanted a bypass, can they not do it? Can they really stop it? They can just delay it, but they cannot stop it. So it is not that will not happen. In fact, that is the point in healthcare industry. The demand is there. In fact, demand is aggravated. Demand is escalated. Demand is elevated. Demand has increased significantly. That medical tourism is going to grow far more bigger as an industry post-COVID because people are waiting. There must be at least $80 billion of business waiting to happen in medical tourism. Now the point is, if the travel starts, and we know that travel is not going to start before 2024, and there are various reasons. The governments are not going to issue visas so easily. The vaccinations are not going to happen that fast. We know that in some part of Eastern Europe and some part of the world, the vaccination is not happening as fast as other places, right? And also we know the travel industry, the airlines are not coming back as they're supposed to be coming back. So travel is going to be slow. And the more slow we see the travel, what we will see, the more healthcare demand is increasing, more medical tourism demand is increasing, more number of medical cases are increasing, and that will put a pressure on medical tourism industry. Of course, there will be a time period that the most of the hospital who were getting a massive medical tourism business will not get it, and that is the reason why they need to focus on more viable industry, viable practices. And we have to talk right now why we need to do more sustainable. Let me give you first of all the definition and meaning of these terms about mindful business practices, viable business practices, and sustainable business practices. And also I will give you explanation why these are extremely important in today's point of view. Let me start with the most important point called viable. Viable simply means feasible, efficient, effective, result-oriented strategy. There was a time where the governments, hospital were spending crazy money in medical tourism and marketing. Few years back, there were lots of money by tourism board pumped into the medical tourism industry. Lots of events happening, lots of activities happening. Can those government, can those association, can those hospitals spend that kind of money again in marketing? Not really. So they need to have a more feasible efforts, need to have efforts which can they see as a return on their investment. So they need to have a more viable strategies, and that's why I'm going to talk about lean strategies. But viable simply mean that there has to be result oriented strategies, right? Second, I will talk about the sustainable strategies, which means now we are in a situation where we need to think about long term. The long term growth of medical tourism is very important at this moment. We cannot just think of pumping something right now, using resources, using or making medical tourism as a one-way street. It is not going to happen. So we need to have more lean practices in medical tourism industry, which means cutting down the wastage in the process, cutting down the huge markups, and making more better budgets in medical tourism industry, and making more sustainable industry so that the industry survive for long run. But you might ask me, what is mindful business practices? By the way, mindfulness is about, whether it is a personal life or mindful business practices, is all about being aware. Being aware what kind of business you are in, being aware who is your customer, being aware what kind of contribution you are going to do, and being aware what kind of impact you are going to leave. What kind of business medical tourism is in? Well, we know medical tourism does generate lots of foreign revenue. We do know it brings lots of patients to international hospital, but this business is more about responsibility. It's about providing care to the people who cannot access, people who cannot afford, people who cannot get into the medical services in country, or they cannot trust healthcare in their own country. So you are not in a business of money making. Medical tourism is a very responsible business. Being aware about that is very important. Every month we get more than 3,000 patient inquiries. Even today we are one of the biggest lead generators in medical tourism. We share leads with various hospitals. You would surprised to know, no one send us a patient lead or patient inquiry that, hey Dr. Prem, we have $2,000, we want to pay you $2,000. Every single inquiry is about, my mom is suffering with some cardiac disorders. I do not have a means of treatment in my country. Please help me. I do not have money for my treatment for my son in my home country. Please tell us what you can do. Be aware who's your customer. Understand what are their needs, what are their wants, what are their demands, and what they are actually looking for. The first thing they are looking for, the empathy. They are looking for your sympathy. They are looking for your care. And most important, in medical tourism, customers are looking for solution. In medical tourism, solution are far more important than just talking about brand, talking about those big practices, talking about those big strategies and all. Customer is actually, it's not a fashionable customer that he wants to wear new attire, he wants to wear new sunglasses, or he wants to buy that luxurious perfume. It's not that the customer. In medical tourism, the customer has a need and he has a want that he really wants to get the medical services from the best quality hospital at most reasonable, with the easy visa arrangement and easy to do activities and all. So your customer is actually looking for that kind of care which you can provide them. So being aware about what kind of business you are is the most important component. Somehow, when there was an inorganic growth of medical tourism, we saw interpreters jumping into medical tourism, those transport company, vehicle driven companies jumping into medical tourism. Nothing wrong. Everyone can do the business. But medical tourism was not that organized, and probably we have got the time to understand what kind of business we are into it. What is the contribution of the medical tourism stakeholders? The contribution is a better global healthcare infrastructure, better global healthcare stream. The contribution is to provide those global healthcare solutions to the patient who are suffering. And how we can do all that? We can do that with more openness. We need to be more open about understanding about different destinations, different cultures, different geographies, different requirements and ethos and ethics of the business. Transparency has to be there. The quality has to be undivided. Quality has to be there in every single practice. We need to encourage more quality-driven practices by government, by association. Care has to be at the center of everything, and we need to put more efforts on creating trust and capacity building in medical tourism. If we don't build the trust and capacity in medical tourism, we are not going to develop the industry the way we want to do it. So let's take COVID as a blessing, not literally in that sense, but for the medical tourism industry, that the pause that we have got, probably that's what we needed. We needed this pause to look back on our industry and see where we went wrong. Maybe we need to stop looking competitor as a competitor and maybe start looking them as a partner. Maybe we can have a more partnership. Maybe we can have a more viable strategies. Maybe we can develop more sustainable structure. Maybe we can look at medical tourism as a two-way street. So I think so there are great leadership challenges in front of us, how we are going to revive medical tourism. But more than those challenges are how to develop sustainable medical tourism. And I'm thanking Dr. Fauzi from Jordan to helping us to create this forum, and also the Hospital Federation and this entire conference and other speaker coming together, and entire organizations and the industry coming together and discussing how we can develop more sustainable, viable and mindful business practices. Thank you. Feel free to reach out to me and I will be available for question and answer as well. Thank you.
So, Dr. Prem, do you wish to add something?
Yeah, just one point that during the presentation, I do talk a lot about medical word and medical tourism, but the terms remain same for the wellness as well. And we all know that the wellness industry does cater to the well-being of the consumer. As Chilla said, we can't call them patient, we can't call them, so let's call them consumer. And in wellness industry, we really need to understand that the consumer of wellness, they are coming for some solution, they are coming for the rejuvenation, they are coming for that happiness. And the stress is a very big factor right now after COVID. So we not only have to rejuvenate them, we have to also de-stress them and provide them those solutions. And while we provide all these solutions, on top of that, we also have to be very careful about our strategies, how we are going to market, because we have challenges in our business right now. As you rightly mentioned, Natalia, at the beginning of this conference, that we can't do the conferences one-on-one personal, too many conferences, but we have to work on whatever methods we have, solutions we have. Within these methods, I think so we have to be very, very mindful. And I'm sure that you all will agree that these challenges are not short term. The impact of COVID is not just going to finish it so immediately. Its impact is long term, but we have to have a more mindful solution. I think I can take a one or two quick question if time is allowed, Natalia and Maria.
Yes, sure.
Can I ask a question, Natalia?
Yes, please.
Hi, thank you very much. I'm Vidya Rani here from Dubai, from Ved Health Services. Thank you, Dr. Prem, that brought in so much positivity for all of us who have just been facing so many challenges in the last couple of years with COVID situation, and brought in that new perspective about looking at from a different perspective of bringing in an organized sector. And I think as stakeholders, all of us would be responsible for it in terms of building that organized structure into the industry. My question is, to the consumer, like for example, patients or guests or customers or clients who are looking for treatments, how do we educate them or make them understand the importance of going through a legal entity, a facilitator who has a legal entity, who's got an infrastructure, who's not like, with all due respects to all the freelancers or translators, with extremely due respect to them, how do we educate the patient to go through a facilitator who is a legal entity so that on a long run they can depend on someone? So this is something that keeps bothering me, and maybe you can shed some light on it.
Vidya, it's always pleasure to hear from you. And when you talk about positivity, I think so you also spread great positivity by contributing in so many conferences. So good to see you active, Vidya. Thank you for being so active. And there was a time, few years back, around 8-10 years back, when there was a big debate between hospitals and government organizations. Why do we need facilitator? First of all, I'm so happy that at least the hospital have realized the role of the facilitator. To be honest with you, I do somehow put this concern back on the facilitator, especially unorganized facilitator. They really do not communicate well with the patient. They do not communicate the benefit a facilitator gives to the patient. A facilitator is a one-stop solution for the patient. Facilitator is a representative. Hospitals do not have a time to do all the arrangements for the patient. Hospitals are always short of staff. Always. Hospitals are always in some or other crisis in terms of staff and organization and all these things. A facilitator is a relationship partner, negotiator, representative, one-stop solution, and also it makes entire process smooth. And many of the time, when a patient asks a question from the hospitals or wellness resort that how much you charge, facilitator just go and just simply tell them, okay, for knee replacement, this is the cost of $10,000. They do not even communicate with the patient what are the benefit of going through the patient. Ease of arrangement, security of the document, very good appointment. If something goes wrong, there is someone to take care of it. So I think so all these benefit we have to educate. And I think so facilitators should come like you in the portals like this and also express their knowledge and ideas about the wonderful contribution they are doing to the industry. For me, they are one of the most essential component of success of medical tourism, wellness tourism, and even global healthcare. Thank you.
Thank you, Dr. Prem. May I set a question?
Yes.
Mindful approach is regular in India, but how to implement mindful practices in Europe culture also?
So the beauty about, Maria, the beauty about these things is that now they are not geographic one side. So for example, you're doing an incredible job of bringing, when I came to your conferences, Abano Tharme, I saw that more than 40 countries, people are coming there together. So when you are doing conferences like these, you are bringing all the knowledge from around the world together. And I think so that's the best way to bring different industry experts. So when I come down to Europe, I would love to talk. I was in last time in Ukraine with Igor Violeta and team of Ukrainian Association. Natalia was there. It was a beautiful, mindful session within the conference. I think we can do something like that in June also. And this is how we can educate not only our industry people, but around the world about the practices of different part of the world. I guess the best option is for us to have these meetings online regularly and offline, one-on-one meeting, maybe once in a year, twice in a year, some places. I think so that will keep this industry moving forward. And I appreciate both of you, Natalia and Maria, for doing this wonderful work.
Thank you, Dr. Prem. So waiting for you in June.
I can't wait.
Thank you.
Thank you, Dr. Prem, and I can tell about this amazing experience. 15 minutes meditation during conference, and after that we was feel fresh and ready to work again and again. Thank you for this.
Wonderful.
Yeah. Okay, thank you, Dr. Prem. And we will continue our conference. So now the pandemic has taught us to be very practical. Therefore, there is always great interest to the experience of experts and companies. What exactly was done to solve some problem? And now I will ask my colleague Maria Antonietta to lead panel discussion. Please, Maria, introduce your panelists. I guess everyone is here.
Yes, we will have now Simon Gregor from Ensana Spa Hotel Cluster and Head of Sales. And then Mrs. Elena Bruno from Palazzo Fiuggi. She is Communication and Marketing Manager. Mamen Martinez Marin from Costa Calida, Cluster Manager in Spain. And Yevgen Sagova from the management of Age Clinic, SHGV Clinic, head of the Global Age Management Academy. Welcome, everyone. So I think we can start with Mr. Simon Gregor. And I would like to ask Mr. Simon, in the past year has shown us ways to adapt business to the extreme. What were your strengths and what basis did you build your new services, if you did build them? Mr. Simon, please open the microphone.
Yeah, okay.
Yes.
I think now I'm online, yes?
Thank you. Welcome, Mr. Perrin.
All right, thank you very much. Good morning, everybody, or good afternoon, depending where you are, in which time zone. Thank you for the question. Well, our main strength, of course, is that we are a leading medical spa company in the Central Europe, that we are a recognized, certified, non-governmental medical institution. And of course, our main strength was that we really have a huge client base. So, and it was, of course, it was a big challenge, but nevertheless, thanks to this big client base, we were able to switch from one feeder market that was in decline to another feeder market that was very much requested. We have lost since March 2020, we have lost practically all our CIS business, almost all the business from the Russia, from Ukraine, from Belarus and so on, that declined more than 90%, especially the Russian market, due to the travel limitations that are still in force here in Czech Republic, went almost to zero. We lost also a big part of German market, let's say 50% of them, 50, because the German clients are mostly the seniors. So this means the risk group, and of course they were not inclined to travel for the obvious reasons. And we have switched to the domestic market that we can actually divide into the two big groups. One big group is the leisure market, the normal leisure tourists who decided instead to travel abroad to stay in Czech Republic, but also, for example, a kind of corporate health programs for the employees and managers of the big Czech companies, such, for example, Škoda, just to put one example that, of course, you are all familiar with. This is one group. And the second group are, of course, Czech clients that came for over the insurance companies that were sent by their home practitioner doctor and by the insurance company. And this really, we felt a strong increase with these clients. They made, I don't know, perhaps even 70%, 70, of our business, and especially last summer, because we are one of the first companies in Czech Republic that introduced a post-COVID recovery program, about which spoke also Mezősi Asszony earlier, the president of the European SPA Association. And we had, for example, in the summer months, we had over 1,000 requests for the post-COVID treatments from the Czech health insurance companies. And actually last year summer, we were actually dealing with a problem with the lacking of capacities in our medical spa hotels. What we are worried that won't be able to get the clients. Actually, we had problems with the lack of capacity, and we were forced then last minute requests. We were actually forced to refuse them because we did not have any capacity left.
Okay, so you did open new collaboration, and what you did give up in the new conditions?
Well, to give up, I cannot say that we really gave up to something. You know, we actually lost something due to the situation in the market, because some of our some of our regular feeder markets, the clients could not come. But I cannot say that we really consciously gave up to something. Perhaps a little bit. We had to be a little bit more strict. We had to enforce some measures in hotel towards our clients, also towards our staff. We encourage them to get a vaccination. We had to enforce, the clients need to wear masks. We had to enforce some limits in the public areas, in the pool areas, and so on. But I would not say that we really consciously gave up something, that we gave us some certain product or something like this.
I understand. And what are your expectations for this 2022?
Well, the expectation is we'll still have big challenges. We'll still have a big fight. At the moment, we work with 4 hotels out of 7. What I think, considering the situation, it's still very good because the people still do not trust to travel. I don't think it's so much the fear of getting infected. I think it's more the fear that today you book your travel, you make your travel plans, and then the next week the situation will change and you won't be able to travel anymore. I think this is now more the reason that people stay back from travel than really fear of the infection. So our expectations are that first quarter of the year, including the March, it will be still hard. And then from the April, we expect a kind of, let's say, stabilization. And we expect to, again, work with the full capacities, let's say, starting from May or June. The only thing that we are not sure yet, how the Eastern European market will develop in the coming months. I'm sure that the Moldavian, Ukrainian market will work well in summer. Let's say the moment for us, the main question is what will happen with the Russian market. We worked already last year in summer very good with the Israeli, also partially with the Middle Eastern market, with Saudi Arabia, with Kuwait, with the Gulf states, to put it like this. And I'm sure that these clients will come back also this summer. The main question for us, what will happen with the Russian market, with the Russian Federation.
Thank you, Mr. Simon. And let's move now to Ukraine with Mr. Eugene Shago. And age management is a very interesting direction. Mr. Eugene Shago, are you here? I do not hear you. Don't see Natalia, if you can help me, because I don't see even the...
Are you asking him? Okay, let's ask a question next. I will
Okay, let's go to Spain, to Mrs. Mamen Martinez Marin. Good morning and welcome, Mrs. Mamen.
Yes,
So,
good morning.
welcome. So, same question also to you. Past year has shown us ways to adapt business to extreme. What were your strengths and on what basis did you build your new services?
Well, in 2020, at the beginning of the big problem, the most important was the safety, the sanitary system, and also all the safety into the medical spa. Of course, in my association, in my cluster, we have hospitals and also medical spa and thalassotherapy centers. And to combine everything, what we did is to be very, to have a protocol, very strict protocol, safety and sanitary protocols. We began, and even we work with we informed the tourism administration how to do that, right? And we are very happy because our medical spa was the first that opened in Spain during after the confinement, but even during the confinement, we had several clients because with the, you can get, at this moment, you could have the medical pass. So all the in Spain, we have several clients that came to Murcia to go into the thermal resort. So that we are very proud of that. And what we have seen is that in April, June, the client was very close to came in his mind. They didn't want to travel, and they were very clever that all the safety protocol should be very important. But after summer 2020, the client was more relaxed because I think that they felt that all the protocols were good. So the most important, it wasn't the safety, but the most important was the relaxing treatment that we gave. And that's what very important for us also. I think that we have learned from the client that now the medical system has changed. I think that the medical way was very focused in the body, and we in Europe or in Spain, we have forgot completely how important it is to combine mind, feeling, and also the body. And that's what we are doing. We began to do that before the pandemic time, and now we are sure that we are in the right way, because what we are trying also to the client is to push them to understand that they are a very important role into its own health. I mean, it's not only what can the doctor do for you, it's not only what the wellness can do for you, it's what can do you for yourself. So that's what we are doing also in our establishment, is to empower the client to see how powerful is the person, and to take skill from the treatment they have into our establishment, that in the way that when you come back at home to go on with this treatment, we don't want to come to visit us, to have the treatment, and after come back to your home and to have the same system. What we want is to stop yourself, to be awareness what we are doing here, to help you to see how lucky we are, because I think that we are very lucky to have the possibility to travel, to go to our establishment, and to realize that because we are lucky, we can go on in this life, and not only because the other helped you, but because you yourself help you.
And what did change in the panorama of the clients? How was it modified? So new collaboration, or did you stop some collaboration, or what did happen?
Well, we don't stop the collaboration. We keep all the communication with all the different channels we have. I think that we don't stop if I think that we work much more than before, because we were more information. We were giving more information to all the different channels and all the different person we work with. And the client, they went much more online, of course, having information of our centers. And what I think that have changed everywhere is the international patient or client. We lost that 100%, but we won a lot of domestic client. So I think that had been also a very important moment to the people that are living close to the establishment, to realize that they have nice center to go. They don't need every time to go abroad to do the treatments. That's also, I think, is important.
Thank you very much, Mrs. Mamen. And I wish now I see that Mr. Evgen is back from and he's available now. So we jump in Ukraine, and we are asking what is the situation in Ukraine, how COVID pandemic and this extreme situation brought the business, and did change your business in your activity, Mr. Eugene. Good morning and welcome. Please switch on the microphone. Okay, welcome.
Good day, everybody, dear colleagues. Glad to see you and thank you for invitation. I am owner of private clinic and consultant of our government for preventive medicine. In our country nowadays, we have, of course, another situation than 3 years before. First of all, it's due to COVID. And due to pandemic, we have several new global messages that change our activity. The first one is requests from clients. Our clients understood that preventive medicine is necessary because not mask, not vaccination doesn't work as much. And if we should protect our life, the life of our families and the life of our clients, we should, due to potential medical problem in future, prevent them in nowadays. And in nowadays, our client ask more and more about preventive medicine for decrease risks of difficult COVID disease. And in nowadays, the main request is change metabolism, decrease the level of diabetes. And in nowadays, the main request is mental well-being, because a lot of people feeling under pressure, under stress, and also after several times COVID vaccination, a lot of patients request for something recovery program for mental activity. That's why we analyzed the request from our clients, understood that the main request is for myotherapy in recreation and recreation for mental well-being. Second, in nowadays we see logic growing down amount of patients abroad, and we understand that it's not a problem for 1 year, it's theoretically for several 2-3 years as minimum ahead. That's why in nowadays we focused only for Ukrainian national medical tourism into our country for requests, mental well-being and myotherapy. From other side, understand that this situation it's not forever, it's for several years, and we are preparing for new big project 2024, 2025 with our partners abroad from Middle East and from China. Suggest them the same technology recreation when you shoot in 1 week, not only organized huge program of detox, you should organize the mental well-being program with support after you will visit the medical center abroad. That's why in nowadays we see shift of activity from abroad to internal, growing up requests for preventive medicine, and we understand and realized new one proposition for our client, mental well-being.
Thank you very much, Mr. Eugene. Natalia, do you have other question for Mr. Eugene?
About for future, what is the plans, of course.
Okay. Mr. Eugene, which is the plans for future? But I think you already mentioned about new cooperation with Middle East.
Strategic plan, it's going online, organized online consultation between clients and doctors in different countries without problems with logistic in online. And in this project online, we see more potential than in real medical tourism. Because we don't know how long will continue this turbulence period, but understand that requests for health and consultation with doctors are growing and growing. And in nowadays, our patients are ready to take consultation from experts in different areas in other countries by online. In preventive medicine, it's enough because we have all other materials by messenger, like lab tests, instrumental tests, and all others we can perform by online.
I have also another question which was not foreseen before, but I would like to ask, how are you communicating to find new clients? So which is your strategy? Which direction? Are you inviting facilitator? Are you doing a post on social media? Are you communicating on newspaper? Which is the way you are now moving for finding the patient when you will restart the market? So this is also, then I will go also to Mamen. How are you moving to be ready for the restart? How are you preparing?
Type of business, we use different type of communication, but in each of them, more and more percentage is social media. We communicate very often with media person, with bloggers, and use them. We nowadays find more clients than in previous time due to different magazines and other channels. So in nowadays, the huge amount of activities is social media and communication with bloggers.
Thank you very much. Ms. Mamen, just a small question also to you. How are you behaving with the facilitators? So which is your way of attracting a new patient, maybe through facilitator or through social media too? Which is the way to?
I think both, but social media and online is very important, but the human person is the most important for me. So for me, facilitator, they know much more than me, the client and the patient. And I think that the client trusts them much more than me, because they can go to my website, they can see me, but it's the facilitator that is speaking with them, that is contacting with them from the beginning. When the client came to me, they have made a way with the facilitator. And that's very important. So for me, the facilitator is more and more important. If before was important, I think that at this moment is much more important. And also because the facilitator is close to them. Because if I want people from Italy, it's the facilitator from Italy that I have to work with, because I'm in Spain, not in Italy. And that is a question of trust. And they can also advise much more because they have a lot of providers, the facilitators. So they can also advise which treatment or which place is the best for this client at this moment. Because, for instance, as I told you before, my hot spring water center, what's the first opening in Spain. If the facilitator doesn't know that, they cannot communicate to the client. But the client is not going to see which one is open, but you know. So for me, it's very important, and also because we are working in health, and the human touch will be always the human touch. For me.
Thank you very much, Mamet.
Welcome.
I wish now to have a trip in Italy, and I wish to introduce Palazzo Fiuggi, which I think did not only a change during this pandemic, but a total revolution, because they have made huge investments to be one of the first leading medical spa in Italy, and really they have done an impressive job during the pandemic. Welcome, Mrs. Elena Bruno, and I wish to ask you, as I asked before to the other colleagues, these difficult times, on which basis did you build your new product, your new services?
First of all, Maria, thank you very much. Thank you to you, Maria, and thank you to Natalia for organizing such an international and so interesting conference. I'm happy to answer your question. And first of all, I think it is very, very important to underline the importance of the Palazzo Fiuggi project, which is actually open just since very few months. It is an important and very big wellness medical new reality in Italy. It was, of course, thought some years ago, and is possibly the only project of hospitality and wellness medical that opened up during this very difficult year. So we opened in 2021, basically in the mid of the pandemic. So absolutely for us, it was very challenging, but on the other side, it was a very, very positive moment because first of all, it's important to say that we start as a team, and as a matter of fact, I've got here next to me part of our team. I'm not alone. Next to me is Dr. De Stefano, part of the medical team. Next to me is Sheila Soliera, which is one part of the operations and also communication and marketing lady, very fully involved with the guests every day. We have the reservations manager next to me, and we have one of the front office team, Alina, next to me as well. So we really were eager to participate to this conference, to listen to our colleagues, to listen to other experiences, and also, why not, to learn from these others. I really loved Dr. Prem words, make partnerships. We do make partnerships with guests and with clients, but we do make partnerships amongst ourselves. We are in the same business. We share the same passion, we share the same difficulties at the moment, but we have to overcome. And to underline very few words, I think, were at the base of the Palazzo Fiuggi configuration. First of all, we are in Italy. And I have to say that the great beauty contest and words were respected by an amazing building, which is part of the history of this region of Lazio. The palazzo itself transmits beauty. Another word is positivity. positivity and happiness is what we need and what we really love and are passionate to transmit our guests, because it is very true. Our guest so far and the public is depressed, anxiety, depressions, difficulties, problems is at the base of the decision of people to look more in their self. So what it's the base of our motto is put your well-being at the center of your world. So it is a difficult time for all of us, but if you look in depth in your heart, you need positivity, happiness, and you want to be happy and to feel well. So we really have to fish in the body of our guests what they really like. And we have to educate them to feel better. We have to educate them to find in themselves the good spirit, the positivity. And we have, very important, to give time to them. We have to give our time, our professionalism, our doctors' advices, our hospitality, our beautiful rooms, our beautiful country, and an underlying beautiful nature of Fuji, because the natural context around all of our centers, our Fuji and our colleagues are definitely located in amazing locations where nature is the base of positivity. So we do have the nature that supports all our effort. Very important for Palazzo Fuji project as well has been the nutrition, and is the nutrition. I would like to all of us to remind the motto, we are what we eat. If we eat well, we are well. If we eat properly, we feel better. So the base of the concept of Palazzo Fuji, next to doctor, medicine, all the practice, the therapeutic approach, is nutrition. And we choose, as a matter of fact, an incredible chef, which has been awarded with a 3-star Michelin. But beside that, he is a researcher himself. He wrote books about nutrition. He is impassioned with what people eat in order to feel well. He loves herbs, he loves cardamom, he loves all the ingredients that support the program that we started. So nutrition on 3-star Michelin, but on a dietetic, detoxifying side is what we are. The COVID has, of course, developed very many bad effects to our body. It is visible, it is not just thought. I mean, people feel weak, people have problems with concentration, people have very frequent headaches, and there are some ingredients that we do regularly use to reinforce the immune system. So basically also the breakfast is very important, how you start the day. The lunch is very important, and the dinner, and of course water. Water is the basic element for life, and we are very lucky that in Fuji we have a miraculous therapeutic water since Michelangelo ages, so we're talking about over 500 years. Fuji water is one of the most renowned and kept medical waters, which is obviously famous for to recover from kidney stones, so kidney problems. But definitely, if drunk in the correct proportions, the water of Fuji has great effect for everybody. Is that correct, Dr. De Stefano?
Yes, definitely correct. Definitely, because it has many actions, not only on the kidneys, but on circulation, on the balance of minerals inside the body. So it's a long speech. It's a long and complete benefit for all the body as a whole.
Dr. De Stefano, you are just one of the specialists of our team.
Yeah.
Which do you think are the most advanced and most requested services from our guests? Which are the areas of interest?
Well, inside the many programs we have that are all scheduled, we can customize any basic needs for each guest. For example, with the most advanced diagnostics, such as mineralometry and retinal scan, ultrasound of every side of the body, for example, abdomen, but even arteries, etc. So we can really design a customized program inside the programs which are more general, for example, optimal weight, but in the optimal weight we can insert and we can tailor side by side anything you want in terms of blood analysis, even advanced such as genomic and genetic blood drawing and tests, and all the best diagnostics, because in the near future we will have also a very, very advanced magnetic resonance, CT scan, and so we can do many, many things.
Fantastic. So as you see, I think that for us it was challenging. It is challenging, but still we just started. So for us it is a very positive moment, because of course we see that as Simon said before, we saw a dramatic I cannot say drop because we just started, but less possibility with the Russian-speaking countries because they are unable to travel. But on the contrary, we saw a very good possible, even more business from UK and Italy. Italy, of course, we're very lucky. The location is close to Rome, close to Naples, so people can easily travel to us. So we are very positive in all the difficulties, because we know that through the right communication, through the right PRs, through the right sales, we have ambassador, we have influencers, of course, with social media, but we use all the ways of communication and sales. And another little point, which is in a way quite different, the company has started from the hospitality business. So the company that opened up Palazzo Fiuggi starts from hospitality, resorts, hospitality. So we know how to make people happy, how to feel welcome. And in a way, the hotel side is teaching this to the medical side, and the medical side is teaching to the hotel side the medical factor. So we are really learning every day from each other, which is really, really good, really inspiring, really team building, and great experience, I would say.
Fully agree.
Thank you very much, Ms. Elena. And I wish to set the last short question to everyone, starting from Mamen Martinez. Which of the procedure of your company are you using for your health to stay active and energy? Are you doing treatments which are in the group of a company that you are working with? Mrs. Mamen.
In the staff, with my staff.
The group.
Sorry, repeat the question.
Yes. If you are taking some treatments, if you're doing some, which action are you doing to stay healthy, to stay active, to have energy, to afford?
Yes. In fact, well, I'm the manager of the cluster, but I practice holistic treatment. So what we do is to introduce that into the different centers. And for me, the most important is now I'm working a lot of with my mind and my body, with internal treatment, mindfulness and Reiki, Zen. I think that my body is asking me for that. And when I speak with the staff in the hospital or even in the hot spring water center, it's the same. We need to clean our mind.
Mr. Simon, same for you. Are you adopting some particular strategy, taking some treatments?
Well, I must be honest, you know, I have very strictly divided business life and private life. So actually, let's say I don't use services of our company or very limited, but what I definitely take advantage of is the position of Mariánska Lázně, because it's really a wonderful town, 650 meters high without any industry. We are actually now not our company, but the town, and we are kind of leader in the project team. We are working on the project to get a certification also as a climate spa, not only as a mineral water spa, but also as a climate spa. And actually, Mariánska Lázně, it's placed in the middle of the forest. There is forest all around. And actually, from the building where I live, there are only 2-3 minutes. I'm already in the forest. So I make a walk through the forest, like, I don't know, half an hour, 45 minutes every day after the work. Just a kind, you know, to release my mind and to go to make a kind of mental feedback, what happens through the day. This is what I really do practically daily, or even now with the short days, I go in the dark, I go through the night. It's a very nice form of relaxation. And that's actually this destination provides me somewhere in, I don't know, Milan or something like this. This wouldn't be possible.
Micro.
Okay, next, Maria, your microphone switched off. So, Yevgen Chagov, if you are still here, please answer on this question, what you personally do to use for your energy. No? Yevgen went? Okay, so Yelena, please give us
Palazzo
some.
Fiuggi.
Well, we, as much as possible, we, as a team, we practice the sound healing all together. In one of our yoga rooms, we love, as soon as we manage, some people that are based here doing more often, some people are not in, so when we can put all us together and we do the sound healing with a Tibetan bell, which gives a lot of energy to all of us together, personally, as one person, and as a team again. Each of us does absolutely activity, physical activity is a master, from simple half an hour walk to play tennis or to other things. I personally play tennis because I love also big sports, but when I'm here, I do use the yoga. We do have yoga regularly, so I'm happy to use the yoga room, and actually we are developing very much the holistic side. So this is something new that is coming up. So the holistic side, which goes along with the medical side, will be all one big family working together. So trying to work on what the Dr. Prem said, the mindfulness. Mindfulness is not only in India, we really need to learn as, let's say, European, the same spirit and the same, sort of, approach. We do have a yoga master with us, and he has just started, and we are developing special programs. It's called Dr. Gupta, and we will also, it's a great addition to our practice. However, we are every single person of the team is very sportive, movement, very careful to food to feel better.
Thank you, colleagues. And dear colleagues, may I ask everyone to switch on cameras and to make picture for social media? Is it possible to everyone? Yes. Please open your cams. Please. Please just. Hi. Thank you. Great. So let's continue our program. Our next speaker, this is my favorite partner. This is Maria Antoaneta Principale. Maria, please share us information with new technologies, what can help such hotels and agencies to work better and faster and maybe more effective for their clients.
Okay, so thank you very much, Natalia. I thanks for the opportunity to introduce you Bookismed. Bookismed is a particular project which collects all the experience from the digitalization in the tourism file, and we are bringing this technology and this experience to the medical tourism. But there is an important difference between the normal website for tourism when we talk about medical tourism, because when we talk about medical tourism, we have to consider facilitator, which never can be put in aside. So more and more medical tourism will run, and the medical sector all will run to the digitalization, because I don't know in the other country, but in Italy, we were totally not digitalized. 99% of the hospital and of the doctor were not online and not connected and not possible to synchronize. So Bookismed is a marketplace where it is possible to find many different providers. Providers are clinic, resort, medical center, and thermal medical center, and medical spa. I wish now to show you when you can surf inside Bookismed to see how it looks like. But what is now the main and the most important aspect which make really the difference is the agenda. So I wish now to show you the agenda. Just 1 second, which I connect correctly. Okay. Just do you see my screen now? Yes. Okay, this is the screen of Bookismed. Just 1 second, sorry. Was okay. The agenda. Okay. Okay, the Bookismed agenda is in the tourism is most known as a channel manager. This is a system to synchronize the availability and the prices, not only with Bookismed, but with many different websites. And very soon I explain you why. So this is from the side of a thermal center, medical spa, or a clinic, the software for the management of a database of clients with the timing and appointments. You see here different colors because these appointments comes from different websites. They comes from the secretary in the resort as well, or in the clinic, as well as from Bookismed, as well as from Booking Health, or thousands of other websites, which now we are synchronizing. So the thermal resort can manage the day life of the appointment of its center, but also synchronize and connect in the same moment many different websites. And we give the technology to doctors, to centers, but also to facilitators. So for us, facilitator are the moving engine of a platform, because behind Bookismed, it is a network of facilitator that we do train weekly, and that can have our technology for free, and they can install it in their website for giving to all their audience of clients the products and all the contents of Bookismed. So with without investing money, time, and technology, all the facilitator can receive from us for free this technology. And this means that we can synchronize. Why? Because what is my experience after every meeting that we do, every workshop, the difficulties of facilitator is to receive the information in a quick time. It means that when we have a client who needs a cardiology service or who needs a post-COVID treatment, and they need availability for today, tomorrow, or next week, we need to have it quickly. And at most of the time, talking with the providers, talking with the thermal resort, talking with the companies, it takes time. And they don't have so much time. Often they have a client in front of them. They need to give a reply, a quick reply. That's why we have developed Bookismed. Bookismed do not intermediate itself, but we need the commission to forward the commission to the facilitator. So Bookismed is not like booking.com, because we do not take any commission, but we are facilitator for the facilitator. So, and if we have information as more as possible on a real time, then we can be very helpful and a big support for the facilitator. So I didn't want to take a lot of time to you. If you want to have more information, if you want to understand better how it works, do not hesitate to contact us. But you can in any moment register for free in our platform as provider or as facilitator. After you register, we will contact you to support and to explain better how to do business together, how to set your products, how to improve your visibility. So thank you very much, and I hope not to have bored you. And I hope to be helpful for your business and for your activity. So
Thank you,
Natalia.
Maria. I know you prepared some cartoon. If you wish, I can ask my team to switch on. Yeah.
Thank you, Natalia. I prefer to send it later, because I did check. They did it very quickly for this event, but I think they did not properly. So I prefer to improve it and to send you one-to-one to you. So within the end of this week, you will receive it by mail or by WhatsApp. Thank you, Natalia. So I don't hear you, Natalia. Okay, perfect. Okay, I think it's now time to introduce Natalia.
Yes.
So Natalia, thank you very much for being our really trusted partner. Before I met Natalia, it was very difficult for me to organize events, because to enter in the medical tourism is a very closed niche of a market. So it is not easy for a thermal resort or for a medical company to find the right partners. So if we go to exhibition, to workshop, often the other part is not profiled. It means a waste of time, waste of money, and waste of energy. So to have a right partner who select properly the audience and the participant is not the half, but more than the half of a job of creating events. So thank you, Natalia, for being such professionist as you are, and to make me meeting a lot of persons as Dr. Prem and a lot of our partners who are really the most trustable in this market. Thank you, Natalia, and
thank you, Maria.
The word is to you.
Thank you for introducing me. I will try to share my presentation and to show you what we will speak now. 1 second. It should be like this. Oh, yeah, it works.
Yes.
1 second. So, I'm Natalia Strakowska. If you don't know me, once again, I am owner of a medical tourism journal, DoctorGEO&SPA. We operating in CIS market already 10 years, and most of all our activity it is marketing for sure. It is business activities, and we help different companies to present themselves. And first of all, we started from Ukraine, Russia, and now we introduce and collaborate with companies in Azerbaijan and Kazakhstan. Also Belarus, so a lot of Russian-speaking activities. And what changes with this corona situation, with this pandemic, how our clients, how our customers can understand your messages. And of course, a lot of resorts, a lot of hotels started to provide this some rehabilitation programs, post-COVID programs, etc., etc. But how to get attention of your client, or how to make your client to back you again and again. So it is, my topic is post-COVID marketing strategy and how to make your new products stand out from other offers. So problem is self-isolation and online technologies, and they made all this information noise so too much acute. So people not reading mails, for switch off some advertisement in social medias, in YouTube, and doesn't see anything. So what is changes? First of all, it is attitude. So now they thinking different. So now people, after they getting sick with COVID, we know it is some problems with nervous system, with concentration, etc., etc. And a lot of companies, and not just medical companies or health companies, it is different. It is shopping, it is some training, a lot of trainings for different activities now available on the internet. So everyone needs to catch your attention. So also you need to catch attention of your clients. So now what you can do, it is the stories and heroes. But it is not normal stories as we know, some story of your business or some story of your client and how you help them. It is a bit another way. Oh, sorry. Our stories, remember it and solve. So it is like information scientific, what they found, human brain found information based of the form of the stories. It is one of the reasons why in some cases completed storytelling can increase marketing performance. And you can see these digits or how people can buy. But why this is important? Because leaders have lost their importance. For example, if I trust my my friend, I will take advice from my friend better than, for example, Julia Roberts, what she do. Because they are leaders, they are far away from me, but my friend is close to me, and I trust of experience of my friend. And trust, it comes first. So first of all, we can build trust with these different stories during our marketing activities. What changes? This is hero is your client. It's not. It is not us. First of all, it is client, and the role of the business, it is just like guider. It is like assistance, but not hero. So it is a second part. It is your marketing strategy has to complete like brandarium, and you can use this brandarium from different activities, for different your offers, even for your new collaboration with some partners, not just for clients. So now I would like to introduce you 7 steps formula. How to build this brandarium and how to use it. I will give you information about each step, but now it is like general. It is first of all, heroes, it's your client. Second, heroes problems. Third, you are only guide. Fourth, it is plan. 5, call to action. 6, failure avoidance. And 7, it is results. First step, hero is your client. Client, it is with the person or this is company with whom you wish to build relationships. It is not us, it is not our hotels, not our services, not our touristic companies at all. It is not about how cool we are. So mostly you can see this story, we are cool, we can make for you everything, just come to us, just choose us, and etc, etc. But now, no, because it is not a way that trust would be built. And the common mistake, everything bad in hero's life, but with us he's fine. Approach with attractive attention. Yes, for sure, the client will see your, for example, mail or some message, but he will leave. He will not buy anything because no one likes it when someone points out a problem. So first of all, it is attitude, and first of all, it is respect. And why we must respect, and we must respect his situation. Do we know the true reason why the situation like this? We doesn't know why it happens with our client. So situation like this, and our role is just to help. Second step, it is problems of our hero. We have to know exactly which problems he's facing in order to build relationship. Our client doesn't need to service in our products. He needs to solution of his problem. So if we're talking on the language of problem, on switch at his problem, so we win. If we're talking about how cool we are, so we have such wonderful services, we are lost. In this step, briefly explain how to service or products solve their problem. Third step, it is the role of guide. It is our role. So we are not ahead. We just next to our client. We are there and we are helping. Often this stage we lose customers when we present ourselves that as problem-solving hero. And it is like in fairy tales, we had never saw that a hero needs hero. Heroes doesn't need heroes, never. It is like Hollywood movies. We can see one hero, and a lot of people around of him. They are guiders, they are assistants. They just help just a bit, And after that, hero use these tools that this guider give them and go ahead. First steps, the guide given the plan. So we have to, in our message, in our, for example, newsletter, we have to give a plan in the first time. So it is plan, it is roadmap, 5 points and more. And it is not like mistake, just make order for our free consultation or make order to give to have something, etc., etc. One consultation, it is not a plan. So your client have to see the way how you're going to help him. It is important. 5 steps, call to action. Sometimes I see some proposals without any information. We have post-COVID rehabilitation, or for example, I opening some page and from first sentence it is just buy us our product, buy our services. It is too early. So call to action is just number 5. First of all, you have to do all other steps that to avoid some afraidness of our client. 6 steps, this is mistake avoidance. So on this stage, we have to explain what kind of failure or problems the client is avoiding due to our help. It is could be a big story, the problems, how the clients, how they, what they got, or something like that. It should be some few sentences, but it should be very particular about his problems. 7th step, results. You have to show which results clients will get if they make an order, if they buy your service, if they solve his problem with you. So it is short presentation about this new approach, and you can use it for every day, even if you're getting some requests, if you're a touristic agency, if you're getting a request and you from client and you wish to help, so you can do this brindarium just for this particular client. Or if you are a spa hotel, if you would like to implement new service, new package, you have to build your proposal due to this brindarium. Now the problem is we can't to promote some COVID rehabilitation due internal some rules, but we can communicate with client by mail. It is possible. We can communicate client through social media and explain all of these your service activities. It is allowed. So please build your marketing strategy during this brindarium, and I wish you a successful year. I wish you have a happy clients. I wish you to be healthy, active, and we hope to meet you live in person, some in place on the world. Thank you for your attention. And Maria, I give word to you, yes, because you prepared something interesting. Or maybe someone have questions for me, please.
Yes, let's give some minutes if someone has some question. Elena, I see you active.
No, it was very interesting, and I love the word brandarium. Really, very cool, very nice. I think what you listed, Natalia, is exactly what it is. Sometimes we do forget things, and sometimes the pressures of too many things around us make us forget the normal rules of life. Very interesting to have it in written, and very happy. Thank you. Very useful.
Thank you. Thank you. I'm happy to be
Someone
useful.
has other question? Anke, I see you smiling.
Yeah, indeed, it's very interesting,
Welcome.
isn't it? It's a very good approach. So thank you very much for the good insights. Really useful.
Thank you. Welcome, Anke. Okay, so now it's time to have a trip in Italy. I have prepared a small presentation. I hope first it runs because there are a lot of video inside. So we have, Natalia, you are sharing, I think, so I don't need to share.
Okay, you can share, yes.
Okay. Okay, then I share. Okay, it says that I cannot share, Natalia.
Выключи, пожалуйста.
Okay. Okay,
One
so
second. Yeah,
now
you
I
can.
can. Okay, thank you. So we have prepared a small trip in Italy because not everyone maybe knows that Italy has 360 thermal cities. So it does not mean hotel, but thermal city. One of these thermal cities is, for instance, Abano Terme, and in Abano Terme there are 120 hotels, so thermal hotels. Some thermal center are inside the thermal hotel, are in the same building. Some other type are with the thermal center, and all around are thermal hotel. But most often is when it is hydroponic therapy. So it means that people drink the water, so they don't need to be neck or to be in bathrobe, or so they can dress and go out. So I have prepared a small roadmap and thermal resort in Italy. So I did take just the most representative cities, which are maybe the most known, and I have divided them for pathology. So each thermal cities is for a different pathology. I have included also 2 medical spa resort, because medical spa are growing in Italy. We have almost 7 or 8 very important ones. Often they are connected to thermal area. Sometimes they do not appertain to therme, but they are just simple medical spa. So first of all, here is the map. Then Natalia can share with you the presentation, or I can share it also. This legenda with different color is for different type of water and different type of pathology. As you see, we can cure with the thermal water arthrosis, fibromyalgia, musculoskeletal system, kidney stones and gut, liver and bile, stomach and intestine diseases, as well as diverticulous, not diverticulitis, but diverticulous is possible to cure. Any pathology has not to be in the acute phase, because all what it is in the acute phase is not possible to cure with thermal water. But thermal water is most often for prevention, not for treatment when there is the problem in its acute phase. So bronchitis, rhinitis, and breathing system, deep detox, deep sleeping, gynecological diseases, psoriasis, hypothyroidism, and circulatory system. And the red one is hemotreatments, which in Italy is not so diffused, only in 2 or 3 centers we can find it. It's the blood washing, which is most a treatment very used in the sport field. In Italy, it did start for treating sportive men, avoiding the cure that create then problem in the doping, and EMO can give a good result to sportive men without entering the doping problems, and is also very good for every one of us. Now I have prepared from this center a video which illustrate each single center, so you can have a small trip and see how is the level of the term in Italy, so you can compare with your country. Okay.
Maria, you need to share a sound with Zoom, because
you don't hear sound?
yes, without sound, yes.
Just 1 second, because I don't see. My sound is open.
No, it is settings. No, not here.
You don't hear?
Setting, it is right and up, right corner.
Maybe Natalia, you can share the presentation, so maybe it's better, because from here I cannot set the sound.
It is not here, dear. It is not here. Please. Oh.
Yes, tell me, Natalia.
It will be without sound.
Hmm? You don't, I'm not able to open the sound.
No.
So let's go without sound.
Yeah.
Okay. This is the Terme of Abano in Montegrotto.
Maybe you can comment yourself.
Yes.
Please.
So as you see, there is also the undertitle in English. Everyone knows the mud of Abano Terme, but what treat is the water. The mud has to remain 60 days in the thermal water in order to develop some particular alga and to enrich with the minerals which are contained in the water, and then to release them during the treatment. These algae are the cyanobacteria, which are developed in these 60 days, staying the mud in the thermal water. Abano Terme has a specific protocol and has patented, so it's also possible for doctors to prescribe the cure in Abano Terme. So that was one of the successful marketing strategy of Abano. The water, the thermal water, which is in Abano Terme, comes from the nearby mountains and go down from 3,000 meters and comes up in Abano Terme after not before 10 years. So it needs 10 years before coming out in the other cities in Abano. And during these parts, it enriched with minerals. The water comes out with 87 degrees. It's very, very hot. As you see here, the thermal water is used also for prevention. The thermal water of Abano treat the arthrosis and osteoarthrosis. I can also add that me personally, I have a very hard coxarthrosis, and I was not able to walk some years ago. So I started also doing this mat therapy, 2 weeks every 6 months, and all the pains have disappeared. So I can really say it works. Now we enter in the next thermal center. Which is, and it should be Hotel President. It's a 5-star in the city center. Here to see how they are organized. Every hotel has, in Abano Terme, its thermal pool, more than one, and its thermal mud center where clients can do mud therapy. The situation of the hotel is now improved because in Abano, 90% of the hotel have been renovated. There was a lack of renovation in the past years, and it had a reason because Abano did grow thanks to the German health insurances. Because German health insurances did pay for the treatment in Abano and for the trips, for the treatment, and for the stay. But since 20 years and more, they did reduce 90% of the refund. So there was a crash in Abano, and the hotel had to find new clients, and they did. These new clients are now coming from France, from Switzerland, and from Russia. These are the 3 most important markets for Abano. And for doing this, they needed to renovate. So they did start one by one to change, to improve, and to renovate. Abano is very close to a lot of activity. First of all, Venice, as cities of art like Venice, Ferrara, Padua, Vicenza, which are full of history and historical and cultural facts, as well as nearby a lot of vineyards, hills, and country agritourism, let's say, and restaurants. So strategically, logistically is well positioned, and that's why it had this great success in the last years, because it offers a lot of extra activity after the treatment. Shopping, also shopping area a lot.
Maria, can you tell about EMT conference that will be held on Abano? And we have B2B meeting in 15 minutes, so we have to.
Okay.
So,
yeah. Yes. EMT will take place this year from 6 to 9 June. You will receive a newsletter and emails. As anticipated, we will host more than 100 buyers and 20 medical insurances, both from East Country and also from Italy. This is also new. Natalia didn't know. It will take part of also the governative health insurance, but also all our agency, Italian agency, are connected, are the sales for the private health insurances, welfare. So it means that all of them are sending patients who are not paying themselves, but it is the government who pay. So I think that this information is important for everyone, because when is not the patient paying, it's more easy to collect new clients and to offer new products. Now I go on the next video and I try to be fast. Okay, Natalia, but I don't know the video, how long they take. Here we are in Castrocaro. Castrocaro Terme appertain to the biggest hospital group, which is GVM, and they have invested 40 million euro to develop this particular clinic and thermal resort. The water is dedicated to skeletal muscle, arthrosis, osteoarthrosis, and bracing system. And the clinic is dedicated to the detox, deep detox, and deep sleeping. This Castrocaro Terme is near Bologna airport, not far away. And they also have bought this group of hospital. They have bought the Forlì airport, which is 10 minutes far from this resort, in order to make easier to the abroad clients who wants to have treatment in the center. They have developed some different paths, and we have to say that is one of the excellent resorts in Italy, together with Palazzo Fucci. Here you have some images. The water is green because it's not only sassobromic water, they have also a second thermal source with the chlorella water. And chlorella is well known for detoxifying from aluminium and heavy metals. This is the spa center. And from outside, it's located on the hills. Okay. Next, we will see a medical spa, which is very close. Very close to Rome Airport. This thermal resort is dedicated to psoriasis. It's in Tuscany and reachable from the airport of Rome. It's not far away from Saturnia, for whom knows Saturnia. But Terme di Sorano is a particular place, as you are seeing. It's in the formula of a residence. We are all apartments with hotel services. They have external and internal pools, and the style is typical Tuscan style. Psoriasis is possible to treat in minimum 3 weeks for the heavy cases. For the light psoriasis, 1 week is enough. It's the protocol of treatment is made by a special diet, detoxing from toxins, together combined with the treatment with the water, and they have a technology treatment which is Syntexer. We will see also later. Syntexer is electromagnetic field treatment. The result on psoriasis, it is certain, so it means that they are not experimenting. It's something consolidated and working well. Natalia, how much time do we have?
We have 8 minutes.
Okay, I will jump now to Sicily. So we will send you maybe the presentation via mail and via WhatsApp, because I want to speak about a particular center, which is Porto Rosa in Sicily, where we are also organizing an important. Sorry. We are organizing an important educational in spring, and I wanted to show you this center. Okay, Ischia. Okay, we are now in Porto Rosa. Okay, Natalia, we have to give the connection. Just 1 second. Just one second to Porto Rosa. Okay. Okay, let me see if they are connected, Natalia, so that we can, okay, Marika is connected. Marika? Ok, apri l'audio. Natalia, could you open the audio to Marika, Axel Travel?
She's open.
Ah, Marika, puoi parlare. Però non ti sentiamo. Prova a mettere le cuffie, intanto io comincio a presentare Porto Rosa. Prova a mettere le cuffie, gli auricolari, perché non ti sentiamo. Ok, ti vedo che ti stai collegando, però non ti sentiamo ancora. Prova a aprire l'audio. Marika. Non ti sentiamo. Ok, vado io, Marika. Inizio a presentare, poi se riesci a parlare raggiungici. Parla in qualsiasi momento, così se ti sentiamo.
Can you hear me now?
Yes, Marika.
Okay, hello to everybody, good morning. A little problem with the audio. So I'm here, hello to everybody, my name is Marika from Axel travel agency in Sicily, in Italy. I wanna introduce you our residence where we have many apartments that you can book for your guests, of course. Our residence is located in North Sicilian coast, in front of Tirreno Sea, and in front, of course, the famous Aeolian Highlands. And it's a residence, as I told you, with many apartments. We have mono apartments, bilo apartments, and as well three apartments, so for 3 people, of course. And it's 400 meters from the beautiful beach. You can find a free beach and as well equipped beach with decks and umbrellas. The residence is located in inside our a touristic port that is named Porto Rosa. This is very close to many attractions, as well as I told you before, Aeolian Islands, but as well you can find in 10 minutes by car Santuario di Tindari, and in almost 20 minutes by car Milazzo, the city of Milazzo, and almost as well 20 minutes by car you can arrive in Capo Torlando, that is a beautiful place. So you have the possibility, of course, to book and to enjoy of many excursions and to see the beautiful attraction of north of Sicily, of course. As I told you, this residence where we have many apartments is inside of a touristic port, Porto Rosa, and you can find very close to each apartment many shops, restaurants, and mini market as well. So people that just enjoy the apartments can provide to find everything they need very close to the apartments. We have each apartment, you can find a lot of comfort. You can find air dryer, irons, and as well you can find bed sheets, towel, cover, so at least the guests can find everything they can need in just to stay and enjoy a week in Sicily. And of course, in our price, we have, as I told you, bed sheets, towel, cover, and as well final cleaning when the guests just gonna leave the apartment, and as well consumption of water, light and gas. Hello,
thank you very much, Marika. We will implement just a few information, because in Porto Rosa, why we have introduced you, they are doing an experiment for hypothyroidism together with the two universities of Verona and of Padua, for solving this particular pathology, and there are some particular protocols, and the devices syntax are also used for these particular parts, and post-COVID treatments, they will also be present. We are organizing with Natalia in Porto Rosa for end of March and beginning of April, two important educational, one dedicated and reserved to doctors. More than 30 doctors will go to Porto Rosa, and more than 30 agencies are welcome to visit Porto Rosa and to discover Sicily. Near Porto Rosa, there are other two thermal stations, and we will also go for visiting them and discovering this particular part of Italy. What to say also that the region Sicily has decided for post-COVID situation to improve and develop and to have more visitors. The region will refund 50% of the flight cost. So for anyone who is traveling to Sicily, for all the 2022, they will refund 50% through the agency of Axel Travel, which is one of the biggest agencies in Sicily, with the 7 offices in different cities. Okay, Natalia, I hope to be fast.
Yes. Thank you. Thank you. So I wish to say thank you, everyone, to you join our conference. We hope it was fruitful and useful for you. And we can invite you to take a part in Thermal Tourism Business Summit next year. I'm sure this online approach, it is very useful, because we can reach different regions, and I hope people will understand it more and don't say, "Hey, I am tired from online." So any case, we can meet it, and this is very wonderful. So now B2B meetings will start it. Who provide these B2B meetings? I wish good collaboration and success this year. Thank you.
Thank you, Natalia. Thank you, Maria. Thank you very much. See you later.
Thanks a lot. Bye.
Bye.
Sì, perché sennò adesso vedo solo che sono domani.